Texas Forest Service is managing crews in 10 counties. The big blazes are all west and north of here, and the smoke they're blowing our way is affecting the health, breathing of some folks. With more on that, let's check with Jared Wise.
You can see parts of the skyline over my right shoulder. It's much clearer tonight. It was a little hazy last night, but I spoke to 5 urgent care centers today who were simply too busy to even speak with us. I was able to get a hold of one, however, who says while allergies are still bad, some irritants from some of that hazardous smoke may be causing health problems that could be even worse than allergies.
Today, I could smell a little difference in the air.
Jordan Walker spent most of Saturday outside, and like some, noticed it wasn't a typical run on the hike and bike trail.
I've been coughing worse, and it's hard to breathe out here.
And he's not the only one. Just in the last few days, this medical clinic in Lakeway has had an unusually high number of patients complaining of the same thing, and even worse.
Unfortunately, we have seen a number of patients with bronchitis, and it's very possible that the precipitating factor is indeed the smoke and irritation that's in the air.
Dr. O'Brien says particles from the smoke can cause problems for the skin, eyes, and lungs. Itchy red eyes, coughing, and sneezing. Many of the same problems experienced by allergies. But it could progress to bronchitis and affect your health in other ways.
Certainly can produce asthma or exacerbation of asthma. It's also very irritating to the eyes, more likely to develop a conjunctivitis or what is typically known as a pink eye.
Dr. O'Brien says being subjected to long-term wildfire smoke could even be compared to the same health complications associated with smoking a cigarette. But there are some things you can do to limit your exposure.
The best thing to do, of course, is to try to stay indoors, to try to avoid the smoke as much as possible. If they absolutely have to go outside, then perhaps a wet cloth over the mouth or nose.
But with a small amount of smoke seeping into the central Texas area for now, many Austinites still don't plan on changing their usual daily routines.
That's the case, but I don't think I'm going to try and hide from it.
Now, of course, nothing has been scientifically tested, so no word exactly what the culprit is now. But if you have any unusual symptoms, you're asked to contact your physician. Reporting live in South Austin, Jared Wise, KXAN, Austin News.